Are you expecting a little bundle of joy? Congratulations! But with this joy comes a lot of questions and concerns, especially about what you should and shouldn't eat during pregnancy. Do you find yourself wondering if certain foods might harm your baby? Are you confused by the conflicting advice you hear from different sources? If so, you're not alone. In this video, we'll uncover the top 10 foods you should avoid during pregnancy to ensure your baby's health and well-being. Stay tuned, because this information could make a big difference for you and your baby. 1. Caffeine. First on our list is caffeine. While a cup of coffee might be your morning ritual, high caffeine intake during pregnancy can be problematic. Caffeine crosses the placenta and can affect your baby's heart rate and metabolism. Research published in the American Journal of Obstetrics and Gynecology suggests that high caffeine intake is associated with an increased risk of miscarriage and low birth weight. It's recommended to limit caffeine intake to 200 mg per day, which is roughly 1 12-ounce cup of coffee. 2. Soft cheeses. Next up, soft cheeses like brie, camembert, and blue cheese. These cheeses are often made with unpasteurized milk and can harbor harmful bacteria such as Listeria. According to a study in the American Journal of Public Health, unpasteurized dairy products are responsible for nearly 70% of foodborne illnesses linked to dairy. To keep your baby safe, stick to hard cheeses or those made with pasteurized milk. 3. Deli meats. Deli meats, such as ham, turkey, and salami, can be contaminated with Listeria. This bacteria can survive at refrigerator temperatures and can cause listeriosis, a serious infection that can lead to miscarriage, stillbirth, or severe illness in newborns. A study in the journal Clinical Infectious Diseases found that pregnant women are at a higher risk of listeriosis. To reduce this risk, it's best to avoid deli meats or reheat them until steaming hot before consumption. 4. Raw or undercooked eggs. Raw or undercooked eggs can be a source of Salmonella, a bacteria that can cause food poisoning. Symptoms include fever, nausea, vomiting, and diarrhea, which can be particularly dangerous during pregnancy. According to the CDC, Salmonella infection can also lead to severe complications like dehydration and preterm labor. To avoid these risks, ensure your eggs are fully cooked, with both the whites and yolks firm. 5. Certain fish. Certain fish like tuna, mackerel, and sardines are commonly consumed but can contain high levels of mercury. Mercury can harm your baby's developing nervous system. The FDA advises pregnant women to limit their intake of these fish and opt for lower mercury options like salmon and shrimp. Research published in Environmental Health Perspectives highlights the risks of mercury exposure during pregnancy, linking it to developmental delays and cognitive impairments in children. 6. Unwashed fruits and vegetables. Unwashed fruits and vegetables can be contaminated with harmful bacteria and parasites, such as Toxoplasma, which can cause toxoplasmosis. This infection can lead to serious complications, including miscarriage, stillbirth, and severe health problems in newborns. A study in the journal Clinical Microbiology Reviews highlights the risks of toxoplasmosis during pregnancy. To minimize these risks, always wash fruits and vegetables thoroughly before eating. 7. Processed foods. Processed foods, such as instant noodles, chips, and packaged snacks, often contain high levels of sodium, preservatives, and unhealthy fats. Excessive sodium intake can lead to high blood pressure and water retention, which are risky during pregnancy. A study in the journal Hypertension found that high sodium intake is linked to increased risk of preeclampsia. Opt for fresh, whole foods instead to ensure a healthier pregnancy. 8. Sugary foods and drinks. Sugary foods and drinks, like sodas, candies, and pastries, can lead to excessive weight gain and increase the risk of gestational diabetes. Gestational diabetes can cause complications such as high birth weight and preterm birth. According to a study in the journal Diabetes Care, high sugar intake during pregnancy is linked to an increased risk of gestational diabetes. It's best to limit sugary foods and opt for natural sweeteners like fruits. 9. Artificial sweeteners. Artificial sweeteners, such as aspartame and saccharin, are often found in diet sodas and sugar-free products. While they are generally considered safe, some studies suggest potential risks during pregnancy. Research published in the journal Reproductive Toxicology indicates that high consumption of artificial sweeteners may be linked to preterm delivery. It's advisable to use natural sweeteners like honey or maple syrup in moderation. 10. Alcohol. Alcohol is a definite no-no during pregnancy. Consuming alcohol can lead to fetal alcohol spectrum disorders, FASDs, which can cause physical, behavioral, and learning problems in children. The CDC states that there is no known safe amount of alcohol during pregnancy. Even small amounts can be harmful. So, it's best to avoid alcohol entirely to ensure your baby's health. Pregnancy is a time of joy and anticipation, but it's also a time to be extra cautious about what you eat. By avoiding these 10 foods, you can help ensure a healthy pregnancy and a healthy baby. If you found this video helpful, please give it a thumbs up, share it with other expecting parents, and don't forget to subscribe to our channel for more informative videos. Thank you for watching, and take care.